as we dive into our last session, I wanted to kind of shift the tone for a moment. So, because so far we've been in learning mode, absorbing what we can from all the experts, and we're grateful for all of it. But I kind of want to change the pace. So instead of talking about caregiving or receiving advice from a professional on self-care or psychosocial support, I want to tap into something just as powerful, and that is each other. So there's something deeply human and healing about sharing our stories. In a community, come on up, Mateo. In a community like ours, storytelling isn't just emotional, it's educational, it's validating, and it's connective. So it reminds us that while our journeys might be unique, we are not alone. So for the next 30 or so minutes, we're going to create a space just for that. And it's hopefully it works. We'll begin with, I had 5, but now we're up to what, 6, 7, and hopefully one more is joining us. We have these brave and generous family members are going to join us here to share their reflections and their challenges and their moments of strength and their questions, and yes, sometimes their messiness. After that, I would like to open it up to the room. There's going to be no slides except for Audrey. No expert panel, just an open invitation to speak from the heart, to ask what's been weighing on you, or to simply listen and feel seen. So this is your space. This is our space. And I hope you feel safe and supported here. So Audrey is going to open us up with help to help us understand what is psychosocial care. And we can also have Andrew Hannig, who's one of our CHD2 dads, but he's also a social worker by trade, and he can help us navigate this complex topic. But his role here today is CHD2 dad. So I'm going to let Audrey get us started. And then when she's done, I'm going to be running around, as I always have been all week, and get your questions, your comments. This is really a feedback for all of us. So we'll see where it goes. So thank you.
All righty. So I think I know how everything works at this time. So apologies for the last presentation. So this weekend, we've heard so much about seizures, genetics, and therapies for CHD2. We've also been given a long list of things that we need to think about and do as caregivers. But what's often missing in a lot of these conferences is how it feels to live this journey as a parent or caregiver. So I'm really glad Marnie and the organizers decided to include this session. The exhaustion, the fear, and the grief, and the constant uncertainty, and the decisions that no one should have to make are things that we face every day. And there are 2 words that we don't say enough in the rare epilepsy spaces, but we should: trauma and grief. Trauma, because this isn't just stress, it's survival mode lived daily. And grief, not just about death, but about milestones that look different and the future you thought your child might have. Naming these things doesn't make you weak, it makes you human, and it gives us a place to start. So today I'll talk briefly about what psychosocial care is, medical trauma and grief in CHD2 families, what helps, and provide some tools that you can take with you. So psychosocial care is sort of a fancy term for the emotional, psychological, and social support that families, the entire family, needs throughout this journey. It's not just about therapy, it's about connection. It's about helping children process fear, helping parents breathe, helping siblings feel seen. It might come from a counselor, a support group, or even another parent. It's not a luxury. It's part of whole child and whole family care. When we care for the family's emotional well-being alongside our child's medical needs, we build resilience. So traumatic events can be big, like a seizure emergency or a hospitalization, or small but relentless, watching your child regress or living in medical uncertainty. Medical trauma happens when stress overwhelms our ability to cope and our nervous system stays stuck in survival mode. This has a name: pediatric medical traumatic stress, and it affects kids, caregivers, and siblings. For some, this progresses into post-traumatic stress disorder, but many families live with persistent stress reactions without ever getting a formal diagnosis of PTSD. The research shows that up to 80% of families report traumatic stress after a serious medical event, and about 30% of parents and 25% of children develop persistent symptoms. But for families like ours, those numbers could be even higher, because this is not looking at communities with epilepsy and neurodevelopmental disorders and all that we deal with. CHD2 families are especially vulnerable. It's more than a diagnosis. It's a life-altering journey that begins early. Families face seizures, regression, behavior changes, the ever-present fear of SUDEP. You're adapting to new needs without a clear roadmap. Although I think you're starting to build this roadmap here, which is phenomenal. Managing school therapies, safety, daily survival, that unpredictability creates chronic stress. And for many, it's isolating. It's not a one-time crisis, it's cumulative, and it's often traumatic. And then there's grief. So again, grief isn't just about loss through death. It's the grief over those missed milestones, the future that looks different that you might have imagined, maybe relationships that have changed. It can come in waves, and both grief and gratitude can coexist together. Trauma is a little bit different. It's the body's reaction to overwhelming stress, and it keeps us on edge even when things seem stable. So both trauma and grief are common in our families, but because they affect our bodies differently, they often need different types of support, and understanding the difference can help us get the right support. So trauma doesn't always look like a crisis. A lot of people that are experiencing trauma look fine on the outside. But here's some examples of what it can look like. For parents, it can look like snapping at your partner, dreading medical appointments, or crying in the car after an IEP meeting. For kids, it could be meltdowns, regressions, nightmares, or constant questions. Those questions are those kids trying to make sense of very complex situations. Siblings often try to be the easy one, or they may act out because they feel invisible. These are not failures. They're normal responses to abnormal situations. So what helps? Healing begins with naming and acknowledging your experience. Saying this was traumatic or I'm grieving can be incredibly powerful. Creating routines that regulate the body, music, movement, 5 minutes of calm or breathing. This is equally important for adults and children. And supporting your child with simple explanations. Tell them what to expect in an age-appropriate way. Give them choices, even small ones. Provide structure and give them that predictability because it builds safety. Make space for siblings. Even a quick walk or a one-on-one moment counts and can help them feel seen. And then find your people, which is what you're doing here this weekend. Other parents who understand. One step toward that connection can change everything. And if possible, find a therapist. Evidence-based trauma-focused therapy can help, and it doesn't need to take years and years. Sometimes just a few visits of some of these therapies can be effective. So here are some types that you might come across. Cognitive processing therapy reshapes how we think about trauma. Prolonged exposure therapy, which sounds long, apparently can help resolve facing what we've avoided in as few as 2 or 3 sessions. EMDR is eye movement desensitization response, and it uses eye movements or tapping to process trauma. And then trauma-focused cognitive behavioral therapy is great for older kids and teens and adults. Play therapy can help younger kids express themselves through play. So these therapies work. They don't require years of talking. They're structured and focused. And then also know that therapy is not just for worst case scenarios, because I cannot tell you how many parents I've spoken to who've said, well, I don't have it that bad, or that person on the other side of the room has it worse than me, or I can get through this, or I'm strong. That's not what this is about. If you're feeling stuck or overwhelmed or just unsure how to move forward, therapy can help you find your footing again, and that can be really powerful. So if you've ever felt anxious or constantly braced for the next emergency, you're not alone. It's completely normal and actually very expected to experience traumatic stress reactions when you've been through what our families have been through. You might be functioning on the outside, but that doesn't not mean you're okay on the inside. Medical trauma and grief are real. Naming them is the first step towards healing. The other thing to note is no two people react the same way. What's overwhelming for one person might feel different for another, and that's okay. There's no perfect roadmap for this, but there is support, and there's this. This is your community. We're all part of a club we never wanted to join, but I'm grateful to be here with you sharing what I've learned as both a parent and a professional. I hope that something I'm sharing with you today and that this panel will share gives you clarity, relief, or a tool you can use. So I'm going to end with this quote. by Dr. Gabor Mate, who's written beautifully on trauma, if you ever get a chance to look at any of his work. People heal in relationships. The opposite of trauma is not the absence of trauma. It's the presence of safety and connection. So that's why we're here. Connection is the path forward, whether in this room, online, or across the globe. Other parents who get it are your lifeline. We do not have to do this alone. Thank you again for having me. The QR code has a resource document with a lot of resources on trauma and psychosocial supports and a lot of the other things we spoke about. And now I'm honored to have our panel of CHD2 parents and siblings share their stories and wisdom with us. Thank you so much.